Hi, so we're at Drummond Street right now. Could you please introduce yourselves and tell us a bit about the programs that you work in?
I'm Claire. I use they, them, she, her pronouns, and I am a youth peer leader on the Queer Space Polaris mentorship program and a youth peer leader on the Youth and Communities Invisible program.
Fantastic. And how about yourself?
I'm Ari. I use they, them pronouns, and I'm a child and family practitioner, so counsellor in the Queer Space family violence counselling team.
Okay.
Yeah.
And what do you primarily both work on while you're here, beyond the names of your programs?
I work with a lot of, so Invisible is a program that runs out of the city of Melbourne. We run events and programs for young cutie pox, so queer trans people of color from the ages of 18 to 25. And for Polaris, we are a mentorship program funded by the PHN, and we are basically doing a really cool organic matching mentoring program for the LGBTQ+ community that came out of a task force for suicide prevention.
Fantastic. And what about you, Ari?
Well, I guess a lot of my work is counselling work, and I work with young people, but adults as well, and families and couples. And essentially, it's family violence counselling, but it's prevention through to recovery, so it's really broad. And because of the high rates of family violence that we know that lots of trans people face, a lot of that prevention work, is essentially like young trans people and their families, and helping those kind of new understandings of the young people to go smoothly, so that those people can have strong relationships with their families.
Fantastic.
Yeah.
And if you could see one really big change within the mental health system, what would you think would make a big difference to the people that you work with?
Well, one.
Like that's one? Yeah.
You can rattle off a few more if you have them.
I think for me, like, the pathologization of trans people is a really big issue, as well as the kind of controlling nature that mental health sector has around trans people's ability to make decisions about their own body and presentation. And I see a lot of people kind of going through that process who actually require counselling in order to cope with what's supposed to be a therapeutic process. So definitely there needs to be more autonomy and self-determination, because we know that that's one of the protective factors for trans people in terms of suicide. Yeah.
I think for myself, it's recognizing, or like overall kind of like decolonizing the mental health sector and putting First Nations people first. I think there's a big gap in that. Also, like spaces after you're a young person, what are you? And there's a huge gap. I think after you're 25, it's kind of like, well, labeled, go, bye, thank you so much for your time. And like having spaces for people between like an elder stage and a young person stage, because then you're an adult, and that doesn't necessarily mean that everything has gotten better.
Fantastic. Thank you both for your time.
Thank you.